The Centers for Disease Control and Prevention on Friday offered a new strategy to help communities across the country live with the coronavirus and get back to some version of normal life. The new guidelines suggest that 70% of Americans can now stop wearing masks, and no longer need to social distance or avoid crowded indoor spaces. The recommendations no longer rely only on the number of cases in a community to determine the need for restrictions such as mask wearing. Instead, they direct counties to consider 3 measures to assess risk of the virus: new COVID-related hospital admissions over the previous week and the percentage of hospital beds occupied by COVID patients, as well as new coronavirus cases per 100,000 people over the previous week. Based on these 3 factors, counties can calculate whether the risk to their residents is low, medium or high, according to the agency, and only areas of high risk should require everyone to wear a mask. But unvaccinated people should wear masks even in low-risk areas, the agency said. The agency had endorsed universal masking in schools since July, regardless of virus levels in the community, but the new guidelines recommend masking in schools only in counties at higher risk. The new guidelines are being released as the coronavirus is in retreat across the country. Case numbers have dropped to levels not seen before the surge of the Omicron variant, and hospitalizations have been plummeting. About 58,000 people are hospitalized with COVID nationwide, but those numbers have fallen by about 44% in the past 2 weeks. Several experts said the new guidelines were appropriate for the country's current situation. Although the number of cases nationwide is still high, we're well past the surge, said Linsey Marr, an aerosol scientist at Virginia Tech. We don't need to be operating in emergency mode anymore. But many places have already shed pandemic restrictions. Most states have eased rules for mask wearing, and some, like New Jersey, have announced plans to lift mandates even in schools.